Good morning to those on the West Coast, and good afternoon to those of us on the East Coast, and good evening for everybody else. My name is Dr. Donna Colaco, and I'm here to present my DAOM capstone research on TCM treatment for post-traumatic stress disorder. So this is an abstract of my research, and I will go over that in this presentation. So post-traumatic stress disorder is a mental health condition with intense physical and emotional reactions triggered after experiencing or witnessing a traumatic event such as military combat, sexual or physical assault, child abuse, violent or accidental death of injury or injury of a loved one, serious accidents such as car accidents, natural disasters such as earthquakes, tornadoes, hurricanes, or terrorist attacks. According to the U.S. Department of Veterans Affairs, 6% of the U.S. population experiences PTSD at some point in their life. 13 million Americans have PTSD, 8% of whom are women, 4% of men, and 7% of veterans experience PTSD. And PTSD has psychiatric comorbidity and is associated with high medical costs, poor work performance, issues with the family, crime, suicide, and majorly impacts many people in their daily lives, from work to finances and overall psycho-emotional health. And many people do not receive sufficient treatment. So traditional Chinese medicine can be a potentially useful and cost-effective tool to treat both the general public and the military suffering from PTSD. The objective of my literature review was to assess the efficacy of traditional Chinese medicine treatment for PTSD. So this capstone reviews the latest evidence-based research on TCM treatment for PTSD, and addresses the following questions. Is TCM effective in treating PTSD? What are the most effective TCM techniques in PTSD treatment? Does TCM treat PTSD better than conventional therapy alone? And are there any adverse effects with TCM in PTSD treatment? So according to the DSM-5, PTSD originates when a person has a direct or indirect exposure to a known traumatic event involving an actual or threatened death or injury, or threat of physical integrity to himself, herself, or others. And they experience the following symptoms for at least 1 month. And that is intrusive memories, avoidance, negative changes in thinking and mood, and hyperarousal. PTSD is diagnosed through a variety of screens. Some of the most common screens are the primary care PTSD screen for DSM-5. And that was also connected to the clinical administered PTSD scale called CAPS, and the PTSD checklist, or other words known as the PCL-5. Another screen is the startle, physically upset by reminders, anger, and numbness. It's called the SPAN. Another one is called SPRINT, which is a short post-traumatic stress disorder rating interview. Another one is called the TSQ, which is the trauma screening questionnaire. Another one is the PSS, which is a PTSD symptom scale. And another one used in China is the IESR, which is the impact of events scale, IESR, revised. So there's a variety of other conditions which are similar to PTSD or connected to PTSD, and here's a list of them. I won't go through all of them. So conventional treatment for PTSD includes psychotherapy, exposure therapy, such as virtual reality, EMDR, which is eye movement desensitization and reprocessing, and pharmacotherapy, which includes antidepressants such as SSRIs, anti-anxiety medications, and prazosin. I go here on my capstone briefly over the pathophysiology of PTSD. So it
Cool.
involves
PTSD.
So it involves the central nervous system, including the amygdala, the medial prefrontal cortex, and the hippocampus. It involves the hypothalamus pituitary and adrenal axis, the HIPAA axis, and the autonomic nervous system. And some of the mechanisms of acupuncture on PTSD is that it affects the central nervous system through the medial prefrontal cortex, the amygdala, hippocampus, hypothalamus, cerebellum, basal ganglia, and insula. And this diagram shows how the qi sensation, the qi sensation from acupuncture stimulates A delta fibers, which end in the spinal cord and connects the adrenergic control center of the brain and the lamina. As for the TCM diagnosis for PTSD, it's based on pattern differentiation. So some of the symptoms for PTSD are palpitations, insomnia, depression, epilepsy, madness, seizures, plum pit chi, forgetfulness, irritability, Lilly disease, benign chi, and drowsiness. So PTSD involves mainly the heart and liver channels, and different authors list different patterns on their research. Some of the patterns are liver chi stagnation, liver depression transforming into fire, heart fire, phlegm fire disturbing the heart and gallbladder, heart and spleen deficiency, heart and gallbladder chi deficiency, heart and kidney miscommunication, and heart, shen, and kidney disorder due to heat, fire, or constitutional deficiency. So since TCM treats according to pattern diagnosis, and PTSD is considered a Shen disturbance, there's a lot of treatments focusing on calming the Shen. So some of those treatments are Buddha's triangle, which is heart 7, pericardium 6, and lung 9. Of course, Yintang and Sichen Song. The Jingwell points can be used to clear heat. Back shu points, they tonify the Zang, such as bladder 14 through bladder 23. The outer back shu address psycho-emotional issues related to the corresponding Zang Fu. So that's bladder 42 through bladder 52. Then the upper kidney points, such as kidney 20 through 27, also address psycho-emotional issues. There's the extraordinary channels, such as the Ren, Du, Chong, so on and so forth, Yang Chao, Yin Chao, which release excess qi stored from trauma or shock. There's the ghost points. There's the sea of marrow, such as Du 16 and Du 20, the influential point of marrow, gallbladder 39, and 5-element approaches such as possession blocks, aggressive energy, husband-wife imbalance, and entry-exit blocks. Several researchers have used auricular acupuncture to treat PTSD, such as Lisa Conboy, who presented at last year's symposium. She performed the NADA protocol on veterans. Elaine Duncan, she wrote the Tao of Trauma, and she used auricular acupuncture also at the VA in Washington, D.C. And Richard Niemzau used battlefield acupuncture in the Air Force. Two of the main protocols used for PTSD are the NADA protocol, which includes ear shenmen, sympathetic, kidney, liver, heart, and lung, which you'll see on the left, and battlefield acupuncture, which is the cingulate gyrus, thalamus, omega-2, 0.0, and shenmen, and that's diagram is on the right. Jason Howe wrote a book on scalp acupuncture, and he founded the Neuroacupuncture Institute. He focuses mainly on Jiao style and Feng style of scalp acupuncture. And the areas which he recommends for PTSD are mainly the foot and motor sensory area, the head area, the thoracic cavity area, reproductive area, and sensory area. So you can see those on the diagrams here below. And the interesting point regarding what Dr. Howe recommends is the needle direction for the head area. So if the person's experiencing insomnia, you point the needle upwards. And if the person is dealing more with anxiety, you point the needle downwards. And then the thoracic area, rather than have it parallel, you will have it pointing towards the midline. So it becomes a triangle like in the middle diagram right here. Dr. Howe also recommends stimulating the needle manually by twirling it 200 times a minute for 2 to 3 minutes every 10 minutes, or using electrostimulation at 100 to 150 hertz for the sensory area and 4 to 30 hertz for other areas for 10 to 20 minutes. Another interesting technique to treat PTSD, which I've used in clinic, is Sa'am acupuncture, or otherwise known as Korean foreign needle technique. According to Dr. Tae Chong Chu, Sa'am acupuncture Sanjao Jongyuk is used to drain knowledge or undesirable memories associated with negative emotions. So this treatment's been very effective in clinic, and all of my patients feel some difference in the way the memory impacts them and the way they react to it. Dr. Joe Chung talks about different patterns and herbal formulas for PTSD. So I won't go into detail on that so we can get to the main research. And additional ways to treat additional TCM treatment for PTSD includes Tui Na, Tai Chi, Qigong, and diet therapy. So the literature review looked at the latest academic research for TCM treatments on PTSD. Online researches were conducted on PubMed, EBSCO, and Google Scholar. And you can see the keywords used here and the inclusion criteria and the exclusion criteria. A total of 17 studies were identified. 10 were titles and abstracts through PubMed. One was a title through EBSCO, and 6 were through reference mining. And out of those 17 citations, 6 were excluded because they were not related to PTSD, not using TCM treatment, or not a clinical study. So finally, 11 eligible full texts were identified for the literature review, which included 1,328 participants. So here is a summary of the TCM interventions for the included studies. One was with acupuncture, one was with electroacupuncture, 2 were with acupoint stimulation, 2 with herbal formulas, 2 with auricular acupuncture, and the remaining 3 were a combination of those. It's difficult to make a fair comparison between these studies because of the differences in diagnostic criteria of PTSD, the different interventions such as acupuncture, electroacupuncture, acupoint stimulation, auricular acupuncture, moxibustion, and herbal formulas. The study designs were very different, varying sample sizes, control groups, treatment duration, frequency, and study duration, and their measurements of primary outcomes. So here you can see the summary of the study designs. So there was 29 to 276 participants for acupuncture and 43 to 245 for herbal medicine. The US tended to have more smaller sample sizes ranging from 29 to 84 participants, and China had larger sample sizes ranging from 91 to 276 participants. And then only one study used sham acupuncture as a control, and others compared acupuncture in combination with conventional therapy, such as pharmaceutical and psychiatric interventions. And as for the herbal medicine studies, only one had a placebo. The other didn't indicate whether the control group was administered with a placebo. Here's a summary of the treatment duration and frequency. So 5 acupuncture studies had a treatment duration of 30 minutes. 1 was 45 minutes, and 2 were for 60 minutes. And as for the frequency, it was ranging from once a week to 4 times a week for acupuncture, 2 to 3 times a day for Chinese herbal medicine. And the studies from the US ranged from 1 to 3 times a week, and the studies from China ranged from 1 to 4 times a week. And the duration of the studies ranged from 1 week to 12 weeks for acupuncture and 2 to 8 weeks for Chinese herbal medicine. And here's a summary of the primary outcomes and what was used to assess the primary outcomes. And those are some of the screens I mentioned before. So I won't go into detail on this because this chart has a lot of information. And there were minimal adverse events in all the studies. Some of them were unrelated to TCM interventions. So the most frequently used acupuncture points are bladder 23, do 24, and gallbladder 20. The most frequently used auricular acupuncture points are Shenmen, sympathetic, liver, kidney, and heart. And for the Chinese herbal formulas, the most frequently used herbs are chaihu, jugansao, and muli. There were only 2 formulas in the 2 studies, and one was called Xiaotan Jieyufang, and the other one is a Japanese formula called Saiko Keishi Kankyoto, or in Chinese, it's known as Chaihu Guizhi Ganjiangtang. And these are the categories of the herbs used in those formulas. So some of the limitations to this literature review is only English language articles were included. So research written in Chinese, Korean, Japanese may have been overlooked, and other useful techniques such as scalp or Sa'am acupuncture was not included. Only TCM interventions were included. So it limited the number of studies available. The diagnostic criteria of PTSD also excluded other trauma-related conditions such as insomnia, anxiety, and depression. The study designs, they varied in sample sizes, control groups, treatment duration, and frequency. And the measurements of primary outcomes was also quite different. There was also a lack of pattern differentiation for the herbal medicine studies. There was a variation in controls for acupuncture, such as needling technique, needle retention, sham acupuncture, and also frequency of treatment. And there was a variation in the acupuncture points. So this literature review indicated that TCM can indeed be an effective treatment for PTSD. However, due to the limited numbers of research available, more studies with well-designed and objective assessments are needed to further confirm the effectiveness of TCM for PTSD. So clinical recommendations, most frequently used acupuncture points from the included studies were bladder 23, do 24, and gallbladder 20. The most frequently used auricular acupuncture points is Shenmen. The most frequently used individual Chinese herbs are Chaihu, Jugansao, and Muli. And based on the study designs, treatments of 30 minutes, 2 to 3 times a day, 2 to 3 times a week would be recommended. And recommendations for further research. standardized PTSD diagnostic criteria, similar environmental circumstances such as earthquake or tsunami survivors versus military personnel, and further research on alternative techniques such as SAM and SCALP. These are the included studies. Here are the references. I would like to acknowledge Dr. Lixing Lao, my mentor, and the Virginia University of Integrative Medicine. And that is basically it. Thank you very much.
It's fantastic. Thank you, Dr. Colaco. There were 2 questions in the chat, so I'll read the first one, but while I'm doing that, would you mind, Ashley asks if you would mind putting the names of the 2 formulas you mentioned in the chat box. Go ahead and do that. Oops, you're on mute.
Sorry. Yes, I can do that right now. And I would like to mention that it's really important to do pattern differentiation when you give Chinese herbal formulas, because in these studies, that was one of my criticisms, is they gave a patent formula to all patients. And different people are going to have different things going on. That's one of the strengths of our medicine. So it's really important not to use this one formula for all your PTSD patients.
And that's a really good point that Dr. Colaco brings up, and that's one of the directions that complementary alternative medicine, TCM specifically acupuncture, TCM medicine research is going, even with acupuncture points, is that they're realizing that the research becomes, we know that it works, right? We know acupuncture works, but is the efficacy better when we do pattern differential, which we all know, right? We're like, of course, but that's the common research. So it's really interesting that Dr. Colaco brought that up, and also that they're bringing it. Which, if you're interested in that, Dr. Colaco, you should look into. Everyone from 5 branches is now going to collectively roll their eyes because I say this all the time. But you should definitely look into doing postdoctoral work and postdoctoral fellowships. You can always email me if you want more information. Anyone can. Natalia asks, she is wondering why you excluded meta-analyses in your when you pulled your research.
Because essentially what I was doing is a form of a meta-analysis. If you include meta-analysis, it's looking at a variety of data and giving you an overall pattern of what they're observing in their research. However, a lot of these meta-analyses are not looking at it through a TCM perspective, which is what are the points which were used? You know, what are the best clinical recommendations based on their research? They're not looking at it through a clinician's perspective, which is what the point of my capstone was. That answer the question?
Yeah, that's fantastic. I copied over the formulas because they accidentally got just sent to me. So everyone has them. Are there any more wonderful questions for Dr. Colaco?
If I had more time, I would have given case studies of, you know, what I had done in clinic. If there's time, I can briefly give one in 1 or 2 minutes, and you guys can email me if you have questions.
I think everyone would love to hear a case study.
Okay.
Maybe it's just me, and I'll just say sure.
Great. So I had a 43-year-old patient come in. Her primary chief complaint was neck and shoulder pain for 4 months. And she was diagnosed with PTSD in October of 2020. She felt that she reacted to stress differently after the traumatic event. And during the PTSD episodes, her heart would run fast and she experienced night sweats and nighttime urination. She also had 3 concussions in 1996, 2007, and 2010. Her tongue was red with little coating and teeth marks. Her pulse was rapid and wiry. And the TCM diagnosis was liver qi stagnation with spleen qi deficiency with Shen disturbance, which is a very common TCM diagnosis. And the treatment principle was to move qi, tonify the spleen qi, stop pain, and of course, calm the Shen. So apart from addressing the points for her neck and shoulder pain, to calm the Shen and to address the PTSD, I actually used the Sanjiao Zhengyuk. So those points are gallbladder 41, Sanjiao 3, those 2 points are tonified. And bladder 66 and Sanjiao 2, those 2 points are sedated. And you only do it on one side. So you can do other points on one side of the body, and you do the Sanjiao Jangyuk, the Korean 4-needle technique, on one side of the body. And what I have the patients do is to think of the traumatic event, to think of the traumatic memory. They don't need to tell me about it. They can just think about it. And then I show them a trash can and I say, here's a trash can. As I put these needles in, I would like you to think about taking that memory and putting it in the trash can. And then I put the needles in, retain them for the duration of the treatment, take them out. And in this particular patient's case, she felt quite a difference afterwards. She said immediately after treatment, she felt like a tightness in her chest and a dry mouth, and drank a lot of water. And then 2 days later, something popped in her throat and she felt an emotional release. And after that, she started setting boundaries with people at work. So it created a cathartic change for her. So that's one of my case studies.